I'd like to welcome everyone to the Vasculitis Foundation webinar today. I'm Kathy Olevsky, the host for the Vasculitis Foundation Educational Webinar Series, and I'm also a patient living with MPA vasculitis. And in today's webinar, we're going to talk about those questions that you may be afraid to ask your doctor, but you probably should. And just wanted to say the opinions that are expressed today in today's webinar are not the opinions of the Vasculitis Foundation, but are just general guidelines. And we hope we empower you to actually ask your doctor these questions. And these webinars are part of the Vasculitis Foundation's commitment to patient education. And we would like to thank our sponsors, AstraZeneca, Amgen, and Novartis, for supporting these webinars. We are super grateful today to have Dr. Elizabeth Brandt with us to help us navigate the questions that we really actually need to ask. And I would like to start by introducing Dr. Brandt. Dr. Elizabeth Brandt earned her medical degree at Albert Einstein College of Medicine in New York. She completed a residency in internal medicine at Tulane University Hospital and Clinic in New Orleans, and she completed a nephrology fellowship at the University of North Carolina Medical Center, Chapel Hill, followed by a Vasculitis Foundation fellowship. She practices nephrology at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire, and Dr. Brandt is also a patient living with vasculitis herself. Welcome, Dr. Brandt. We're so happy to see you again today.
Well, hello, Kathy. It's very good to see you. I'm kind of excited about these questions because they're the fun ones.
Yes, well, we're excited that you agreed to answer them. And honestly, I do hope patients will ask their doctors, but I love that we're going to touch on them as much as we can today. So maybe that will get them having conversations.
Absolutely.
And I think if it's okay, I'm just going to dive right in and get started.
Of course.
The first one is, and these questions come from patients, so that's how they're phrased. First one is, I would like to get a tattoo, but I also have active vasculitis, EGPA. What are the possible risks? Should I wait until, or if I go into remission before having it done? There are just so many questions about, do I time it in between rituximab infusions? Just lots of questions.
Right. And as Kathy said, so I'm going to give you my thoughts about these. There's no, you're not going to find any literature about any of this, but I'm just going to give you my opinion if you were my patient in my clinic. But you should be able to ask your doctor. And if you have somebody there with you and you want privacy, say, I just need to talk to my doctor alone. They're not going to tell anybody else what you ask. So be brave to do that. So, and I'll give you my opinion, and then you can go to your own doctor and see if they give a different opinion. So you can kind of decide for yourself. So as far as tattoos, so what I would say first is if you're going to get a tattoo, you have to get a professional tattoo. So no prison tattoos, okay? Nothing like that. Don't have your friend do it. No. An actual professional tattoo. That being said, I think that even in an ideal world, there's probably a risk of infection from a tattoo. I mean, we get infections in the medical community as well, even when we're using sterile technique and all that kind of thing. So I think if it were me and I had active vasculitis being treated, I would probably not get a tattoo during that time. I just think that's a little risky. If you're on prednisone, your skin's not going to want to heal as well. So if you really have a burning desire for a tattoo, I would wait until you're in remission, and I would wait till you're not on any sort of immunosuppression, just for those reasons. Infection risk. Is there otherwise any specific reason not to get a tattoo? I don't think so, but I would not do it while you're immunosuppressed or certainly while you have active disease.
Okay, great. Thanks for that opinion. We appreciate it. The next one is another super common one. I've gained so much extra weight due to the prednisone. I wondered if I could take these new diabetic injectable treatments such as Ozempic to help take the weight off. What are the risks, benefits? What do you think about that, Dr. Brandt?
Yeah, so this was probably the hardest question we got. And this was one you would have to ask your own doctor about because they would have to be the ones to prescribe it or refer you to someone who can prescribe it. So I'm going to tell you, I don't know the exact answer. I don't know in terms of using something like Ozempic in the context of weight gain due to prednisone. You know, that's sort of its own weird thing, the weight gain due to prednisone. So if you have really gained a lot of weight, do talk to your doctor about it and see if that's an option. Are there any particular risks to it? Probably no more risk than there is to sort of anybody taking one of those meds. So the other thing I would say, this is not my way, just my way of deflecting and not answering the question is, and I've said this in talks and discussions before, once you've been diagnosed with vasculitis, then you're going to get all this medication, immunosuppression, oh, the prednisone, we love the prednisone. Use it as an opportunity. I know that sounds weird, but use it as an opportunity to take the best possible care of yourself that you can. If you're like me and you think that exercise is a dirty word, well, make friends with it. Be active, eat super healthy. Like, you know, I think you will be surprised at the difference if you do that versus if you're a junk food eater, I'm not really, if you're a fast food eater, I'm not really, you will notice a big difference if you kind of can change that a little bit. So you may find that if you can make those sorts of changes, that you don't need something like Ozempic. So all I would say about the Ozempic or any similar medication is I would not rely on that because they may not be as effective when you're talking about weight gain due to prednisone, because we all know it's kind of its own special weird thing. Easy to get on, hard to get off. So do your own work yourself first. You may not need it. I don't know that there are any particular risks as it relates to being on prednisone or having vasculitis. And the benefits, of course, are going to be maybe that you're going to lose some weight, but I don't know if it's more or less effective when it's weight gain due to prednisone. But just take good care of yourself. That may not even be a question for you then.
Well, that's great advice. And kind of as a follow-up question to that, do you tend to lose weight as you taper off the prednisone? I mean, is that just what you work towards and then you start to lose it?
Yes, I'll tell you, it's very different for different people. Some people don't really gain any weight. I don't know why that is. And then I've had patients gain a lot of weight. I will say that a lot of weight is probably less common than you might think. And some people, once they're off prednisone, they still have a little bit of a time trying to get that weight off. It seems to be a little bit more stubborn. But you shouldn't have to gain, that's a weird way to put it. You shouldn't have to gain like an extra 50 pounds because you're on prednisone or 100 pounds. I've seen that. That you should be able to sort of manage a little better. You might put on 10, maybe 20 pounds, but you're probably not going to really start getting that off until you come off the prednisone entirely.
Well, thank you. I know that prednisone weight gain thing is such a difficult thing for patients that are newly diagnosed, and it just adds to everything that we deal with.
Even if you don't gain weight, you get the nice round face, right?
Yes.
And so you'll look like you're fat, even though your body is exactly the same weight as it was before.
Yes, and I will say, having been all through that the moon face does go away. It just you just have to get off the prednisone, and prednisone does all kinds of things to people.
Yeah. And that,
so
you're right, that will resolve pretty quickly.
And if I could just follow up to that, I'm just thinking about what you said, and I know that when we are in active treatment for our vasculitis, it's super important what we eat and control the only things that we can control at that time in our life. And is it true that these injectables, these new things, Wegovy and all the ones that are out there, are they do they like limit your appetite? And wouldn't that just kind of work against you in some way because you need the nutrients that we would from a proper diet?
Yeah, so they definitely, from what I understand, and I do have a couple patients on them, not that I've prescribed them, and it suppresses appetite for sure. So I think then you're still going to be eating, but you're still going to have to make those careful choices about what you're eating. Now, I don't know that it changes your, it may decrease appetite. I don't think it changes necessarily the appeal of certain foods, one versus the other. So I don't think it's like when you have really bad kidney disease and suddenly things don't taste good. I don't think it's anything like that. What I would say, now this is partly my opinion, although I would argue science-based opinion, is that the more you can focus on a plant-based diet rather than an animal product-based diet, that the better you're going to be. Whole foods, fresh foods, the less you can tamper with the food that you're eating, the better it is. And so pre-packaged, pre-made, processed foods, no bueno, just no bueno on those. So that would be my biggest recommendation diet-wise, is focus on a plant-based diet. There's a lot of literature out there. There are a lot of materials out there. You don't have to do some special diet with a name. You just eat plants instead of animals in general.
Well, I mean, that's some great advice. I mean, the question was about weight gain, and there's some good advice from a doctor on an alternate plan. So I appreciate that.
Yeah.
So the next one is, my 25-year-old son has GPA. He wants to try vaping with his friends, but I'm very concerned about the risks, especially when he's getting rituximab treatments.
Okay. So this was the one question about which I have a very strong opinion. Very strong opinion. Do not vape. Do not, it's bad. It's just bad for you. It's not like, oh, it is healthier than cigarettes. No, it's not. It's just different. You don't want to inhale anything into your lungs. If you have GPA and you have lung involvement, geez Louise, don't do it. If you have GPA and you had lung involvement and you're in remission, guess what? You've still had injury there. Don't do it. I have seen patients who actually are perfectly fine. They are perfectly healthy people. One comes to mind who was actually being evaluated as a kidney donor. So she was very healthy. And I'm examining her and her lung sounds terrible. I was like, what in the world? And she could tell me exactly the onset of her symptoms. She was a little bit of short of breath, maybe a little bit of cough, was exactly when she had started vaping. It's just not good for you. If you just think about it as, what would you want to inhale into your lungs that you think wouldn't hurt your lungs? You know, maybe some steam from a facial, like that's about it. But you don't want anything else going in there other than the air that you breathe. So I do have a strong opinion about that. Vaping is not good for people. It does cause lung injury. And if you've already got a problem, doesn't matter if you're immunosuppressed or not. It's just, vaping is not a good thing.
So that's some really great advice. That question was obviously from a mom, and she needed some talking points to go over with her son. So you just gave her talking points, and they can come back and watch this video together.
Yes, and her son can call me, and I will be happy to.
Okay, so you heard that also. Awesome. Okay, and the next question is, could the doctor talk about having alcohol when you're under treatment for vasculitis? Can it interact with prednisone? I mean, that's a good question.
Yeah. Okay, now I'm going to sound like somebody's mother, and I'm only mother to cats, so I don't even know what I'm doing, but don't drink a lot of alcohol. I mean, that's just not a good idea in general. If you are, going out to dinner or dinner at home or whatever, and you want to have a glass of wine or a beer or something, that is probably fine. I don't think that you're doing any harm regardless of being on treatment or not being on treatment. What I would say about the prednisone, again, I'm not going to be able to point you to any literature that I know of, but think about prednisone and what it has done to your mood already, if it has done anything to your mood, and then add to that alcohol, which is sort of a depressant, as it were, like a mood depressant. So you may find that for you personally, those two things don't interact very well. And again, different people kind of have a different experience with prednisone. Some people, it doesn't seem to affect them. Some people, it makes them raving lunatics. I mean, honestly. So some people, it makes them very angry. Some people, it makes them euphoric. So if you add alcohol, which affects pretty much everybody's mood, and usually by sort of, bringing them down a little bit, then you personally, anyone, may find that the two don't mix very well for you. So I would do it with caution. Maybe don't do it while you're out in public. Try it at home first if you really want to do that. So I don't think there's any hard and fast don't do it, but you may find that that they don't mix well for you.
Great advice. And also, since you and I both know my doctor, this is pretty much the same answer that he gave me. And I did try a glass of wine here and there, and it did not agree with me. But everybody has to, do just what you said and try things in moderation and see how it goes. But thank you for pointing that out. And
you may find that for some people, I personally think that prednisone makes things taste weird. It's anybody who's had it can tell you it's so bitter, and it's very hard when you take it, if it hits your tongue at all, to get rid of that taste the entire day. So it may make things taste a little funky. So I would think that would be true for alcohol. You may just find that it doesn't taste quite like you were expecting it to. So not a bad thing particularly, but it just may be an effect that it has.
Okay. Speaking of steroids, here's another one. Steroid therapy is horrible, but I know I have to take them. Sometimes I just want to start tapering them on my own. What should I say to my doctor about why we can't start reducing the steroids? I can't tell you how many times I've heard people talk about, well, when I don't feel good, I just up my steroids a little bit and that gets me through, and then I taper back down. I would love for you to address this, Dr. Grant.
Oh, geez, I'm crow. Okay. I wholeheartedly agree. Steroid therapy is terrible. Before I get into the meat of the question, what I would say is what is fantastic is that we know now, and that we know this from studies, even when they're not specifically about the steroids, we know that we do not need nearly as much steroid therapy as we thought we did. Just bringing it way, way, way down. And my guess is even with the sort of quote unquote lower doses that are being used now in some of the trials, we probably don't even need that much. The other thing that we now have is a new medication that works entirely differently from the rituximab, the cyclophosphamide, the prednisone, everything that I think is terrific adjunctive therapy. And so that may mean needing even less prednisone. So I'm not a big fan of the adjusting your medications yourself. Give people credit, like you feel bad, you feel bad, you feel bad, you don't need to tell me that. But it would probably be helpful before you go increasing the steroids on your own. Oh yes, I do hear it quite often. Check with your doctor, because what you're experiencing, what if you're feeling terrible because you have an infection that you don't recognize? Well, now you're increasing your steroids, you're going to make that worse. Certainly put you at higher risk. So I would always check with your physician about tapering your steroids. Now, I think it is perfectly legitimate to say, hey, can I get off these steroids faster? Because that may be possible. Like I have sort of a general prednisone taper I write when I use it, which is not all the time, but I adjust it for the patients, because some people who are like really, really, really sick, I may make it a little longer. Some people who aren't as sick, I may make it a little shorter. And so, we do that at the start of treatment, but we don't know exactly what's going to happen with a patient during treatment. Maybe they're responding so well that you don't need to keep them on that much. So I think definitely ask your doctor, but don't manage your medications yourself, please. Please, I beg of you.
Okay. We've heard the answer, everybody. You need to pay attention to that. Okay. And next, I would like to try some CBD products to help relieve the pain from my vasculitis. Could the doctor talk about the benefits or possible risks from CBD while having active vasculitis?
So to answer a question with a question, I would ask what exactly someone means by CBD. Are they talking CBD oil? Are they talking CBD lotion? Are they talking about something they're ingesting? Are they talking about using pot brownies? Like what exactly they mean? I would say a little bit like with the thing about vaping, I would not suggest that you smoke pot to help with your pain. No, just don't do that. There have not been studies that I know of, really quality studies looking at the use of CBD. You will find people, you could just walk out on the street and you could say, hey, have you ever used CBD? And they'll say yes. And you go, did it help? Oh, yes, it did. I would call that a placebo effect. We just don't I mean, literally, it's now being, you'll have people saying it helps with pain, it helps with insomnia, it helps with, the foot fungus, literally everything. I just don't think that's true. I just don't think there's anything to support that. If it's, if you're like putting a couple of drops of CBD oil on your tongue, it's probably not a big deal. I just wouldn't expect anything much out of it. But again, nothing inhaled, please. But I think there is limited risk with something like the oil or the lotion, or, cream or whatever. But there's probably little to no benefit either.
Okay. And I think that one of the messages that you keep saying is that you should feel okay to ask your doctor that question, right?
Absolutely.
Like
Absolutely.
Why would they ask this in this forum and not be able to ask their doctor for whatever reason?
Right.
Or maybe, like you said, they need privacy to ask a question or two.
Right. So there may be a couple of things. One is, one of this is about the 25-year-old son who has GPA. Now, a 25-year-old ought to be able to ask that question. You're all grown up now. So you're an adult. If you have a parent or parents that are still sort of locked in with you, going to every appointment and all that, that's wonderful. The support is wonderful. But at some point, you have to have a little separation of church and state there. You need to have some time alone with your doctor to ask whatever questions you have. There may be questions even more anxiety provoking than any of these, or embarrassing or whatever. So do feel free to say, or if your parent goes with you to the visit, say, you just stay out here in the waiting room. I'm going to go in by myself. Your doctor is not going to ever then go out to your parent and say, well, what so-and-so asked me was. They can't do that. They cannot do that. If they do, you need to get rid of them. Oh, that was harsh. But anyway,
that was good.
That's how I feel about that. And you all probably know some doctors are very serious and they're very somber all the time. That's just their personality. Don't hold it against them. That's just who they are. Still ask them the question. My guess is they're still gonna, I don't think that you're gonna mortify anyone. Any of these questions we talked about today, I cannot imagine any physician taking care of patients with vasculitis is going to be shocked, embarrassed, horrified by any of these questions. These are very reasonable. They're very frequent questions. Literally in clinic all the time, I get these questions, these same questions. If you are sort of the younger adult persuasion, you may still be sort of in the pediatric provider arena. So one thing would be to think about transitioning to the adult providers. But even I can promise you a pediatric provider gets questions like this all the time, right? Because they're dealing with patients of that age who have these kinds of questions. So you ought to be able to ask if you truly think that or if you get a negative response, negative in the sense of angry, annoyed, that's a stupid question. You just need a different provider, because these are not stupid or unreasonable questions. These are the questions that everybody's asking, regardless of whether they have vasculitis, right? Everybody wants to know, oh, is it okay if I get a tattoo? Is it okay if I vape? It's never okay if you vape. I know I said it before. Just I can't help myself. So yeah, so you ought to be able to do that, and do ask for privacy. I mean, I have plenty of patients who transition from the pediatric clinic to my clinic. Sometimes they don't do that till they're 20, 21 years old. That's not unusual. And for some of them, they come by themselves. For some of them, a parent comes, and I'm like, well, is your mom or dad here? Yeah, they're in the waiting room. Did you want them to come in? Oh, no, no, no. I want them to stay right out there. So you should be able to ask for that.
Well, we appreciate knowing that we are not the first person to ask these doctors these questions. So we should ask them. And regardless of their personality, they've heard the questions before, right, and it's okay to ask them. So that's great advice. Sort of a follow-up to that, since we're talking about CBD and relieving pain, I have two of them. One is a patient that asked, I want to ask my doctor for stronger pain meds, but I'm embarrassed about I'm not sure what they would think of me if I do that. So got any advice for?
Yeah, that one is a little bit tricky in this particular era because everyone is so paranoid about opiate pain medications, specifically to some extent benzodiazepines. Um, don't be surprised if you ask your vasculitis provider and they say, I don't prescribe pain medications. That is what I would say. I don't prescribe. I have exactly one patient that I prescribe a very, 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 very mild pain medication for. She takes it once a day. Not worried about her. She's more worried about her than I am. But otherwise, because they're not my forte. They have changed over the years. I don't know the dosing for them. I frankly don't want to learn the dosing. So don't be surprised if they say, I don't really do that. Most sizable institutions will have somebody who does pain management. We have a whole pain management clinic here. The advantage to going to somebody like that is you can describe to them the kind of pain that you're having, because you're not going to necessarily treat, say, the neck pain as same as like pain from having muscle cramps. Those are two different things. Or joint pains. Well, that may just be inflammation, and maybe there needs to be adjustment in your vasculitis meds. So do tell your provider, your vasculitis provider, see what they have to say. And if they say, well, I don't feel comfortable prescribing pain meds, well, is there somebody I could see specifically for pain? That one, I will say, is probably awkward because, yes, a lot of people are going to get the side eye when they ask that question. But your vasculitis provider of all people should know that you are legitimately having pain and how to get you some assistance with that. That is a hard one.
Okay, well, thanks. We needed to ask it. And speaking of pain, what is your opinion about doing acupuncture for aches and pains? Is there a problem with people that have skin involvement in their vasculitis and getting acupuncture, or?
Yeah, that's a great question. So to the extent I know anything about acupuncture, which is not a ton in terms of specifics of where they're putting needles, and I know they go different places for different things, I would not want to put needles somewhere where I have skin involvement, like in that specific area. That doesn't seem like a great idea. I think that there's plenty of information to suggest that acupuncture can be very helpful for various things, including pain. I go to a really, I don't know even what the certification or licensing is, but go to somebody who knows what they're doing. Now, interestingly, the previous question about just pain management in general, some pain management physicians also do acupuncture. So that would be a reasonable thing to ask at the same time. I think there's probably no harm to it. Just don't put the needles where you've got lesions, icky stuff on your skin. But otherwise, I don't think there's going to be any harm to that. And you may get some benefit.
Okay. This one, you probably have the answer in what you said earlier, but will my medical marijuana cause complications to my vasculitis?
Yes, you're right. So I would say probably not. Please don't just use something that you're inhaling. It's just not good. It's not good for you. Eat a brownie. Go ahead, eat a brownie. I don't care. So I don't see that being an issue.
Thank you. You've answered it in many ways. How about, this is an interesting question, and one that I had when I was early in treatment. Is there a problem being around a newborn baby who is getting vaccinations while I'm on various chemo treatments?
Ooh, wow. I've not had that one. I'm going to say no. So first of all, I don't know the vaccination schedule for children, but for sure they're going to be getting things like probably tetanus and diphtheria, Tdap, that whole thing. Measles, mumps, and rubella. One or more of those actually is a live virus vaccine. But they're vaccines, they're just enhancing that child's immune system. I don't see any way for somebody around that child to get exposed somehow to that live virus. So I don't see that being an issue at all.
Okay.
I'd be more worried about the the school age, preschool age, who's around all the children with the snot on their face and all that kind of stuff.
Yeah.
Far more of a problem.
Very valid point. So I appreciate all the time that you have given us today answering these questions. My feeling is that once our patients watch this webinar in particular, there will be more questions. So can we come back to you in the future for another session of this with all the other crazy things that we don't want to ask our doctor for some reason?
Absolutely. And if anybody wants to reach out to me directly, just get in touch with the VF. They can tell you how to do that. As long as I can't answer, obviously, treatment questions for you specifically, but if you have a question like the stuff we talked about today, I'm happy to give you my unsolicited or solicited opinion about those.
Well, thank you so much for spending your time with us. And I'm just going to pop in and share a screen here. I think it's sharing properly, just to say thank you to you and also to the Vasculitis Foundation for providing these webinars for patients and doctors, and also to our sponsors, Amgen, AstraZeneca, and Novartis.
Beautiful. Thank you for having me.